Larry Thexton, and I am the Insurance Coach, and this is your 2-minute drill brought to you by Trusted Insurance Solutions. Today we're going to talk about 3 terms in the insurance industry that people have heard, they're familiar with them, but they don't quite understand exactly how they work and how they're going to impact their plan. Those 3 words today are deductible, coinsurance, and your max out-of-pocket. So let's start right off the bat. Usually when you get your plan from your employer, you get 2 to 3 plans or options, and one of them is a high deductible plan. And usually with a high deductible plan, that means low premiums, which for a lot of us, that's kind of the option that we have. What can we afford? So the deductible, here's kind of the definition of the deductible. The deductible is how much you're going to pay before the plan starts to work for you, how much you're going to pay before the plan kicks in. A lot of times, hey, I've met my deductible, good, now I'm covered. Well, not so fast, my friend, because the next term that comes in is coinsurance. But before we get to coinsurance, let's talk about max out-of-pocket. Max out-of-pocket is how much that you're going to pay during the plan year. So you know when you look at your plans, look at the max out-of-pocket, and whatever happens that year on covered services, that's how much you're going to pay. You need to budget for that. A lot of people get upset because, hey, I've got insurance, but we didn't count on this. Well, you needed to when you signed up for that plan. What is the max out-of-pocket? If A, B, and C happens, this is the most that I'll be responsible for with this plan. So we know the deductible. We know the max out-of-pocket. That in the middle is where coinsurance kicks in. So let me give you a quick example. You had a $5,000 deductible. You've got $13,000 max out-of-pocket. So when you hit your $5,000, you're going to have coinsurance. And coinsurance is a percentage that you're going to pay and the percentage that the plan will pay until you hit your max out-of-pocket. So, hey, we've hit $5,000. My coinsurance is 20%. So I will pay 20% of covered services until I hit my max out-of-pocket. So why is that important? A lot of us, if you're living paycheck to paycheck or you have less than $500 in your savings account, the IRS said about 40 to 50% of Americans pre-COVID had less than $500 in their savings account. A high deductible is important because if we have a high deductible plan and we are out of pocket $5,000, where's that money going to come from? And for a lot of us, we just don't know, and we stress and we worry about healthcare, even though we're paying premiums every single month. We're scared what's going to happen if I do get sick, or if my wife gets sick, or if my children get sick. At Trusted Insurance Solutions, our goal is to get low deductible plans out there. So when you're sick, we want your premium dollars that you're paying each month to kick in and cover your primary care physician. If you have to go to urgent care on the weekend, we want primary care dollars to pay for those, and that's kind of what we hope to do. But I think it's important, you as a consumer, you need to know what your deductible is. That is very, very important. And know this, a high deductible, those are post-tax dollars that you're going to be using to pay. So when you cash your check, that money is going to be used, your take-home money is going to be used to keep covering medical care. Think about that, because if you have a high deductible plan, that middle option, look at that middle option, because you can take that premium and it's a pre-tax deduction. We want to get those deductibles down because we don't want the deductible to stand in the way of us seeking out care. So deductible, coinsurance, and max out-of-pocket, those are 3 terms that you need to know when you select your next health insurance plan, either through your employer or if you buy something on the individual market. I'm Larry Thexton with Trusted Insurance Solutions, and this was your 2-minute drill.